Visible?
Yes,
So
sir.
1
Yes,
year
sir.
old male baby weighing 10 kg posted for congenital hydrocele repair, child had cough, all these things we have seen. So always analysis of the case, 1 year old baby, so pediatric age group and the concerns regarding pediatric age group. Second, recently recovered from the LRI, so reactive airway possibility. Patient may be hyperreactive airway may be there. History, always take the birth history to rule out prematurity at birth, any neonatal issues, growth, whether the growth has been normal, weight gain. This is another important thing all of you should learn before your exams. The weight gain, what is the appropriate weight according to age? There is a Weech's formula that you must be very thorough with, and the examiners are fond of asking whether this 10 kg is okay for 1 year old. Then how do you know this 10 kg is okay or not for a 1 year old baby? You
Age
must
plus
ask what
size.
is the birth weight. If the birth weight is 3 kg and it is 3 times at 1 year, that is a fine growth. That's a good normal growth. Okay, so you must always note the birth weight also to find out whether the older children have gained proper weight, and milestones and immunization, all these things should be inquired. Then examine the child, make a general examination for nutrition and airway, any dentition which has erupted, and then see for other congenital anomalies because it's a congenital hydrocele, and RS examination to rule out any residual LRI, for which you do what is called the post-tussive auscultation or carinal stimulation auscultation. Then anesthetic management, avoid GA, specifically endotracheal intubation, because even though the child apparently looks very normal and recovered from the LRI, safer way is to avoid endotracheal intubation or instrumentation. IM ketamine with caudal block will be the preferred choice, and ketamine can increase secretion, so always add vagolytic and drug like atropine or glycopyrrolate. If at all you want to secure the airway, LA may be used if GA is contemplated. They may ask you about hernia block also, the technique, nerves involved, or everything about caudal, and be prepared to answer for anatomical and physiological differences between pediatric and adult patients and challenges in anesthesia due to the differences. And fluid management in children, anatomy of caudal space and technique of block should be, you must be very thorough with, and dosage of various levels of local anesthetic that you use for caudal block and drugs with concentration or any additives. And because these procedures are done as a daycare procedure, suddenly the examiner may jump to all questions on daycare surgery. How do you prepare a child for a daycare procedure? What are the selection criteria? What are all the anesthetic techniques that are suitable for daycare procedure? What are the discharge criteria? All these things they may suddenly ask, in leaving out all these things. So you must be prepared to answer that also. Okay, so that is the thing that I wanted to tell you. Right, any questions?